Dr. Daniel Alford, Professor of Medicine and Director of the Clinical Addiction Research and Education Unit at Boston University School of Medicine and Boston Medical Center. I'm going to be speaking on opioids, pharmacologic, medical, and behavioral characteristics in long-term management. I have nothing to disclose with regards to commercial support. So the agenda will include epidemiology and trends. We'll talk about the neurobiology of opioid addiction and treatment, and then focus on a few special populations. So epidemiology and trends. So this is data from the National Survey on Drug Use and Health, which is a national survey where they identified past year substance use disorder in individuals that they interviewed. And it turned out that 7.5% of our population in the US has a past year substance use disorder, or 20.1 million people. And as you can see, the majority of these individuals have an alcohol use disorder. And this is the number with an illicit drug use disorder, 7.4 million. And then if you look at the specific drugs, marijuana is first, followed by prescription pain relievers, followed by cocaine, and you can see the rest that follow. And essentially 1.8 million Americans have an illicit prescription opioid use disorder, whereas 600,000 have a heroin use disorder. So from that same National Survey on Drug Use and Health, they asked about past month illicit drug use. And you can see that 10.6% answered yes to past illicit drug use, with the vast majority using marijuana or cannabis, followed by prescription pain relievers, followed by tranquilizers and cocaine. But in summary, 3.3 million stated they used an illicit prescription opioid in the past month, whereas 50,000 said they used heroin in the past month. What about opioid prescribing? Well, we can see from the 1990s, there was a dramatic increase in opioid prescribing, majority of which was for chronic pain. And the green line is showing an increase in morphine milligram equivalent. So the dose was also increasing along with the increase in prescribing. But that all changed in around 2011, 2012. There's been a decrease in both opioid prescribing and the dose that we've been prescribing, although we're still pretty far away from the early 1990s. What about opioid overdoses? Well, it depends on what time period you're talking about. And this is data from the CDC, where you can see there was a wave one, which is a rise in prescription opioid-related overdose deaths. That's the purple line. And then you can see it's starting to level off. And then around 2010, we started seeing a dramatic increase in heroin-associated overdose deaths because heroin was becoming more available, whereas prescription opioids becoming less available. And then now we're in the wave three, where there's been an increase in synthetic opioid overdose deaths, which the majority of which is fentanyl, illicit fentanyl that's being manufactured overseas and transported to this country, either by mail or across the border. And you can see this dramatic increase. What about changing patterns of first opioid used? Now, these are the percentage of patients who were being admitted for addiction treatment for heroin addiction. And you can see that in the 1960s, 80% started their heroin addiction by using heroin. But that started to decrease while we started seeing an increase in individuals starting their addiction with prescription opioids, and that was in the 2000s. And what's been happening more recently? More recently, we're seeing, again, individuals who are seeking addiction treatment for heroin addiction, a decrease in those that started with oxycodone or hydrocodone, and an increase in those starting their addiction with heroin. So now heroin, again, is the number one opioid that people use when they develop an opioid use disorder.